This video sponsored by BuyMote shopping app. BuyMote e-shopping application is one of the online shopping app now available on Play Store and App Store. Question is cold shock is also called as. Options are option A obstructive shock, option B hemorrhagic shock, option C hypovolemic shock, option D cardiogenic shock. This question, correct answer is option C hypovolemic shock. Hypovolemic shock means shock due to insufficient amount of fluid in the circulatory system due to bleeding, diarrhea and severe vomiting. The question is which position would be best for patient showing sign of shock? Options are option A semi-Fowler, option B high Fowler, option C Trendelenburg, option D modified Trendelenburg position. In this question, correct answer is option D modified Trendelenburg. In modified Trendelenburg position, the patient head is low and the patient's leg are slightly raised above the heart level. It is used for shock patients for restoring the brain perfusion, and it is contraindicated for neck and head injury patients. The question is action of epinephrine for a shock patient. Options are option A increased cardiac contraction, option B improve consciousness, option C tachycardia, option D reduced cardiac output. This question, correct answer is option A increased cardiac contraction. Epinephrine, other name is adrenaline. It causes vasoconstriction mainly into arterioles of peripheral circulation. So it used when peripheral circulation is impaired. Adrenaline also causes vasodilation into skeletal muscles, liver and coronary arteries, and it also increases cardiac activity by increasing heart rate and force of contraction. Question is which AV block also referred to as Mobitz type 2? Options are option A first degree AV block, option B second degree AV block, option C third degree AV block, option D complete heart block. This question, correct answer is option B second degree AV block. In second degree AV block, only some atrial impulses are conducted to the ventricles. There are two types of second degree AV block. Type 1 second degree AV block, also known as Mobitz type 1, is almost always a disease of AV node. Type 2 second degree AV block is also known as Mobitz type 2, is almost a disease of distal conduction system in between the Purkinje fibers and bundle of His. First degree AV block, in this condition, prolonged PR interval can seen in ECG. In third degree AV block, other name is complete heart block. It is a condition, a complete dissociation between atrial and ventricular systole, or no impulses from atrium conducted to ventricle. Fifth question is RH factor in the blood was discovered by. Options are option A Landsteiner and Weiner, option B Louis Pasteur, option C Jansky, option D none of above. This question, correct answer is option A Landsteiner and Weiner. RH factor is an RH antigen found on membrane of the RBC. It is discovered in 1940 by Landsteiner and Weiner.